Hi, I'm Barbara, and I'm back with Dr. Sibthorpe, and we're going to answer some of your questions. Dr. Sibthorpe, the first question I have is from Anita. She says, when I smile, you can slightly see my gums. What would be the best treatment for this? Botox or lip filler?
Okay, so that's what we call a gummy smile, and it's caused by the muscles here elevating the top lip more when we smile. So the best treatment for that is Botox, and what that will do is stop too much elevation. It's a relatively straightforward treatment, but we do see a lot of gummy smiles actually, more and more these days.
I know, I see a lot of them. I'd like to get them fixed. Penny has deepening lines above her eyebrows and wants to know if Botox or filler would be best for treating these lines. Everybody seems to be confused about Botox and filler. Botox and filler.
Actually, we use Botox and fillers in combination. And so, again, it's really about the indication and whether it's an appropriate treatment. So, referring to this question, lines above the eyebrows, is it at the medial aspect, the more central here? Is it over here? Precisely where that is very important because we're looking at different muscle groups. Now, typically we would use Botox in these areas, but where we start to see the lines higher up just above the eyebrows, we have to be very careful about the amount of Botox we use and also that distance above the eyebrow, because you can in fact make the whole thing worse by causing a brow ptosis, which is where you get a depression of the eyebrow itself. So the filler aspect, we do use that as well, as I said, in combination with the Botox, where the lines are more ingrained or they're more static. Again, it's an area you have to be very careful with regards to the anatomy and making sure that you're not impinging any vessels or nerves, come to that. And so, seek out a professional practitioner to do this kind of work.
Oh, good advice. Lizzie wants to know, how often should you exfoliate your skin?
Okay, it's an interesting one because I think there's more discussion now about that. And I think, again, it comes down to that individual, what their skin type is, their age. As we get older, the skin becomes thinner, particularly in the female, so you probably want to do less exfoliation. We've got to be careful not to destroy the skin barrier. It depends whether you're using it in combination with other treatments, typically retinol, and if you're using the right type of exfoliator, they tend to cause dryness and redness and irritation. So you want to be very careful how you use the two when you're starting out and not overdo it. Typically, patients have been advised in the past that you exfoliate once a day, but I think it does very much depend on your skin type and a lot of some of those factors as well. So it's almost a trial and error method, but again, if you approach it with a less is more and build things up and then don't overdo things. I mean, the exfoliation, what's the idea behind it? You're just trying really to take away the top layer of dead skin cells and at the same time encourage new collagen growth beneath.
Okay. So, and I guess it depends where you live. If you live in the city, if you work, if a young girl or anybody's working in the city, there's pollution, there's
good point.
Lots of different stuff going on. Or if you live in the country, it's a lot cleaner.
You're right. I mean, they actually do now have cosmetics that are pollution, anti-pollution. But I think that it comes also down to nutrition. How good is your nutrition? How good are you at feeding the skin? The skin needs certain vitamins. Is it getting those?
Does your skin need a reboot?
Does it
basically what you're saying.
Does it need vitamin C? Does it need vitamin A? Is it getting all the nutrients it needs? Are you getting sufficient water, hydration? All of these are very important, including the hormones I mentioned and touched on earlier.
But you always said that everyone should get a very simple skincare routine.
Yeah.
That has always been your philosophy. I personally think, because I look at Instagrams, I look at the everything, TikTok, whatever, people are overdoing it.
I think they do. And I think that, you should have a simple skincare regime, a bit like brushing your teeth, but don't overdo it. A classic one would be retinol, for example, where people are using quite high concentrations of retinol. So I think that, whilst you're developing that skincare regime, it's good to have the advice of a professional to guide you, certainly in those early stages. The other thing is that, as we go through life, things change. So it's also important to be able to adapt your skincare regime. But generally, the components of that are not going to change much. You're going to want to exfoliate. You're going to want to feed the skin. You're going to want to protect it from environmental damage, but from internal intrinsic damage. So you're going to use antioxidants. You're going to want to protect it from the sun. So there's a lot of factors to consider, but start low, start slow, and build things up, but don't overdo it.
Oh, that's excellent advice.
Yeah.
Okay, what's next? Jack. Jack's my favorite name. Thank you, Jack, for writing in. Jack has always had nasal folds that are pretty visible since he was a child. He recently lost weight and noticed that his nasal folds have worsened. Would you recommend getting fillers? I'm 32 years old.
Okay. So 32-year-old male with nasal labial folds has gone through some weight changes. So I think, take the history, do the assessment, find out how much there's any particular causes behind that, any reasons, any things you should be looking out for. If it's nasal labial folds, is it caused by some degree of natural aging? Is it caused by a lot of volume loss of the deep plane? So a good assessment before any treatment is important. Again, the old-fashioned way was to fill these nasal labial folds with filler. That's very old, outdated. If you've got nasal labial folds, you've got to think why have I got those? How they've developed. Typically, it's occurred through an aging process where you have loss of volume and descent of tissue, and that causes these to occur. So your treatment approach is going to be looking to lift and volumize areas where they've lost that volume. So you're looking to really elevate mid-face to elevate and sort of get rid of these nasal labial folds. The other thing is important is that you'll never or shouldn't really eradicate nasal labial folds. If you actually look at a baby, they have very chubby cheeks, and you'll see these. But so that's normal, and that's to do with the skull. So as we get older, we tend to have more soft tissue changes that causes these. And then when we get older still, we're getting some of those bony changes that will, again, accentuate volume loss and descent, lack of support, create these kind of things like nasal labial folds, or jowls is another one, of course. So see a practitioner, experienced, get the assessment, probably, again, approach it with a less is more, and build up slowly if you need to address those, and don't overdo it.
Okay, good advice. Sarah is asking how to minimize the appearance of jowls.
Oh, well, jowls, we were just I just touched on, and jowls typically are these areas here. And these, again, are part of that aging process. We tend to see them after the nasolabial folds, these here. They tend to develop later, but again, it's usually losing support and volume from mid-face, also angle of the jaw, changes at the chin, so you're losing support. You're getting a little bit of jaw or bone retrusion, lack of support there. So treating the jowls, we typically look at what we call the pre and the post-jowl area, so that these are the areas that we're addressing. The one area that we don't treat directly is the jowl itself, because you're going to make it worse. So again, a good assessment. What's the cause? What's causing those jowls? What's the age group? Again, what's the sex? Are these, what are the causes behind it?
Okay, good advice. That's it.
Yeah,
that's all our questions.
So if you have more questions, please look at my website, www.drsib.com, and by all means, please submit any questions that you have, and we'll bring them up at the next Q&A session. Thank you.
Bye-bye.
Bye.